my name is Sam DiFilippo, and I am the Program Manager of the Addiction Recovery Center of Excellence here at Equilibria. Today, I wanted to talk to you about the differences between moderation and abstinence as a treatment plan goal to help you decide which one might be best for you. When we talk about substance abuse and addiction, it's generally recommended that people take an abstinence-based approach to their recovery. However, that isn't the best fit for everybody, so what's the difference between abstinence and moderation, and how do you know which one is going to be best for you? Most people are aware that abstinence means fully refraining from any sort of substance use. So this would mean being fully sober, not engaging in any sort of social drinking or drug use, versus moderation would mean that I'm able to engage sometimes, but not all of the time, and I am able to exhibit some form of self-control around how much and how often I'm engaging with these substances. For example, if you're somebody who can drink socially with friends, but when you go out you have a little bit more than you intended to, you might be somebody who would benefit from a moderation approach. And the goal with moderation is to really get a sense of what your intentions are going into drinking, how you're feeling during drinking, and figuring out a way to engage in healthier drinking habits so that you're not drinking as a coping skill and you're able to drink socially for fun. For example, if you're somebody who likes to go out and have some drinks with your friends, but you feel like you drink more than you intended to in these scenarios, you might be somebody who would benefit from a moderation approach. And the goal in therapy would be to really get a sense of what your intentions are going into a night of drinking and what your thought process is around drinking and having more drinks versus stopping after a certain number of drinks. On the other hand, if you're somebody who never feels like they have control over their drinking and consistently overdoes it anytime they're drinking, even if you tell yourself, I'm only going to have one or two, you might be somebody who would benefit from an abstinence-based approach where it's all or nothing, because if you have the choice, you will go all in instead of moderating. The decision between being abstinent or moderating really is an individual decision and has to be made intentionally, considering all of the factors. I hear a lot of people say, well, I don't start drinking in the morning, I only drink after 5 p.m., or I don't drink during the week, but I drink on weekends. And the frequency isn't necessarily the problem, and that's not what's going to help decide whether you need to be abstinent or whether you can moderate. The deciding factor is going to be, are you able to gain control over your drinking, or do you consistently feel like you are out of control when you're using substances? If you feel like you need to develop better habits surrounding your substance use, but you've never tried moderating before, that's a good place to start. And what that can look like is setting an intention prior to use. So if you know you're going out drinking with friends after work, set an intention of how many drinks you're planning to have. If you tell yourself, I'm only going to have 2 drinks, see if you can hold yourself accountable. See if you can stop after 2 drinks. And if you can't, then try again. And you will get to a point where either you realize that you're able to moderate and you're able to set an intention going into drinking and successfully complete that, or you'll find that every time I set an intention, I go beyond that. And that might be a sign that abstinence might be worth trying. Recovery is not a one-size-fits-all approach, which is why it's so important to have a therapist who understands this and can help guide you in making the decisions that are going to be right for you. Feel free to reach out to Equilibria, and you can reach out to me directly as well to get connected with somebody who can help you navigate your decision-making process around your substance use.